Welcome back to the Remdesivir Files, a COVID-19 chronicle. In today's episode, we'll explore a crucial aspect of the pandemic, science communication. With the rapid developments around COVID-19 treatments like Remdesivir, it was essential for the public to understand the science behind these interventions. In this episode, we'll dwell into how media and social platforms influenced public understanding and discuss strategies to improve scientific literacy in future health crises. Joining me today is Saakshi Sharma.
Thank you for having me. It's an important topic, especially given the challenges we faced in ensuring accurate scientific communication during the pandemic.
Let's start by discussing how the media and social platforms shaped public understanding of remdesivir. Throughout the pandemic, many treatments, including remdesivir, were often discussed in the news. In your research, how did media coverage of remdesivir impact public perceptions, especially in terms of its effectiveness?
The media plays a significant role in shaping public understanding, and in the case of remdesivir, its portrayal in both traditional media and on social platforms had a profound influence on public perception. In the early stages of the pandemic, media outlets often presented remdesivir as a promising treatment given the initial trial data and its inclusion in the treatment protocols. However, due to the evolving nature of scientific evidence, there were instances when media outlets overemphasized the drug's efficacy before all data was fully analyzed or peer reviewed. For instance, reports of early positive results from the ACTT1 trial were widely disseminated. But the media didn't always contextualize the results in terms of the study's limitations or the unresolved questions surrounding its use in different patient populations. This led to heightened expectations among the public, who may have assumed that remdesivir was a universal solution, even though its benefits were found to be more significant in certain stages of the disease and for specific patient groups. On social media, the situation was even more complex. Platforms like Twitter, Facebook, Instagram became hubs for both scientific information and misinformation. Inconsistent messaging, often driven by rumors or exaggerated claims, led to confusion. For example, users on social media sometimes shared personal anecdotes about their experiences with remdesivir, which contributed to anecdotal evidence that was not always aligned with scientific data. This reinforced a confirmation bias where people would seek out information that supported their pre existing beliefs about the drug. Moreover, the speed of social media and the viral nature of posts meant that any new development, even if preliminary or inconclusive, could quickly gain traction. As a result, public trust in the drug fluctuated, sometimes based on incomplete or prematurely shared information. The fact that remdesivir was associated with early stage treatment protocols, but not universally effective across all cases, was often not fully communicated in the media's initial reports, which left the public with an oversimplified understanding of the drug's capabilities.
That's a great point about the complexities of information sharing across platforms. With the flood of information from various sources, what strategies could be used to improve scientific literacy and help the public better navigate this information?
Improving scientific literacy in the general public is crucial, especially during health crises like a pandemic. One of the core strategies to improve literacy is to focus on transparency and clear communication from trusted scientific and medical sources. For instance, health organizations like the WHO or the World Health Organization or CDC and national health bodies need to provide accessible explanation of the scientific concept in plain language. This can help the public understand how drugs like remdesivir work, why clinical trials are so important, and how scientific consensus is built over time. A key aspect of improving scientific literacy is emphasizing the scientific method, helping people understand that science is a process that evolves. Instead of presenting findings as absolute truths, which can create a false sense of certainty, it's crucial to communicate that science is iterative. For example, explaining that remdesivir's effectiveness was still being evaluated in different patient populations help manage expectation and reduce the risk of misinterpretation. Another strategy is engaging influencers and trusted community leaders to help communicate scientific information in a way that resonates with different audiences. In this case of remdesivir, public figures, healthcare professionals, and even patients who had been treated with the drug could help clarify the nuances of the treatment. Localized communication could be more effective. For instance, region specific influencers could provide relevant context, particularly in areas where health literacy levels might differ. In addition to the messaging itself, providing interactive tools for the public to access accurate and updated information is valuable. For example, simple infographics explaining the stages of the drug development or the role of clinical trials could help demystify the process. Websites and mobile apps could also feature real-time updates on the status of drugs like remdesivir, explaining changes in data and providing context on what the latest findings means for patients and healthcare providers too.
Are at the heart of improving understanding. As we move forward in science communication, especially in future health crises, how can we ensure that the technical details of a drug's development, like those of remdesivir, are communicated without overwhelming or confusing the public?
One key factor in communicating technical information effectively is storytelling. While scientific data can often feel abstract or overly complex, weaving those facts into a narrative can make the information more relatable and understandable. For instance, explaining how remdesivir works using a metaphor, like describing the virus as a factory and the drug as a lockdown, could help non experts grasp what's happening at the molecular level without delving into the complicated chemistry behind it. Another important approach is to simplify without oversimplifying. It's crucial that we highlight key details such as the time window in which remdesivir is most effective or the criteria for patient eligibility, but without losing the essence of the science. Instead of inundating the public with the dense clinical data, it's better to highlight a few key points that explain how the drug works, its limitations, and why it's only suitable for certain patients. This can help ensure that the public isn't left with the false impression that it's a one size fits all solution. Moreover, it's important to focus on the context of the data. For example, the ACTT1 trial showed a reduction in recovery time, but the public needed to understand the range of conditions and the cohort of patients that were studied. By emphasizing the significance of clinical trial design and the idea that the real world results can vary, we prevent the misinterpretation of findings. Lastly, the public must be educated about the role of peer review and the scientific consensus in validating findings. Communicating that science knowledge evolves and that initial reports may be updated or revised as more data is collected can help manage expectations and reduce confusion when guidelines change.
These strategies are so crucial, especially when it comes to preventing confusion and building trust. Finally, as we look ahead to future health emergencies, what do you think could be the most important takeaway from the communication efforts around remdesivir's development and use?
One of the key takeaways is the importance of timely, consistent communication that balances technical accuracy with the public comprehension. In a health crisis, it's easy to focus on speed, but clear communication shouldn't be sacrificed for haste. There's also a need to correct misinformation promptly, as this can be just as harmful as the virus itself. Timely updates based on new data must be presented in a way that keeps the public informed and reassured rather than confused or misled. Additionally, I think we learned the importance of engaging with a wide range of stakeholders, the scientists, clinicians, media outlets, social platforms, and the public to create a unified message. Cross sector collaboration is essential, and while there may be challenges in aligning so many voices, doing so ensures that people receive consistent and reliable information. Finally, the pandemic highlighted the critical need for scientific literacy as a part of general education. If we can equip the public with the ability to understand and question science in a rational way, then we'll be better prepared for future health crises. This means starting early, making science a part of everyday conversation, and ensuring that people feel empowered to make informed decisions.
Thank you, Sakshi, for such an insightful discussion on science communication in the context of remdesivir and the broader pandemic. Your insights on improving scientific literacy and ensuring clarity in public health communication are invaluable.
Thank you for the opportunity. It's clear that we have much work to do in improving the way we communicate science. But if we take the lessons from this pandemic seriously, we can be better prepared for the next challenge.
And thank you to all the listeners for tuning into this episode of the Remdesivir Files, a COVID-19 Chronicle. Stay tuned as we continue to explore the science, trials, and real-world implications on COVID-19 treatments. Until next time, stay safe and stay informed.